Sickle cell anemia is a genetic blood disorder that changes the very shape of life, starting with our red blood cells. Normally round and flexible, these cells become hard, sticky, and shaped like sickles or crescent moons. They clump together, block the blood flow, and starve the body of oxygen, causing pain, fatigue, and life threatening complications. Each year, nearly 3 lakh children are born with sickle cell disease globally, most in Africa, the Middle East, and India. Shockingly, up to 70% of them don't survive beyond the age of 5 due to lack of early care. In India, the crisis hits hardest among tribal communities, who make up 8.6% of the population. That's over 67 million people. Symptoms begin as early as 6 months of age, from anemia and delayed growth to swelling in hands and feet, frequent infections, vision problem, and sudden pain crisis that can last days or send a child to the ICU. Over time, the disease leads to organ damage, strokes, blindness, joint collapse, and dangerous pregnancy outcomes. It affects not just the body, but the very rhythm of life. The cause, you ask? The genetic mutation in the hemoglobin gene. A child must inherit one sickle gene from each parent to develop the disease. If only one gene is inherited, the person becomes a carrier with no symptoms but capable of passing it on. The good news: early diagnosis is possible. A simple blood test can detect the faulty hemoglobin even in newborns. Prenatal testing, ultrasound screening for stroke risk, and genetic counseling offer families a chance to plan and protect. Treatment has come a long way. Blood transfusions, antibiotics, and hydroxyurea help reduce pain and complications. In some cases, bone marrow or stem cell transplants may offer a cure. And with breakthroughs in gene editing and stem cell therapy, science is edging closer to rewriting the future for these patients. To combat the crisis, India launched the National Mission for Elimination of Sickle Cell Anemia on July 1st in the year 2023 from Shahdol in Madhya Pradesh. The goal? Well, to eliminate the disease by 2047 through universal screening, premarital counseling, and accessible care, targeting 17 high burden states and people aged 0 to 40 years. It's a bold mission with a whole of government and whole of society approach. The sickle may be small, but its shadow is long. And unless met with timely action, it can take away childhood, dreams, and even an entire generation. The fight needs awareness, science, policy, and above all, compassion. Because no child should suffer from a disease we already know how to prevent. Harshita Obroy's report for Wellness Watch, DD India.